if I can just return to the point about pay for the social care workforce. I think we've heard a variety of evidence in this committee, and we've heard it in recent days, that pay could really make the change in terms of retaining people within the system, because we know the challenges that exist, particularly when social care workers can earn more in Lidl, for example. Has the Cabinet Secretary done any cost-benefit analysis, any analysis of what the change and the difference made to the NHS would be in terms of attendance at A&E, delayed discharge, if we were to move to a position of £12 an hour, then looking to raise that to £15 an hour in the course of the Parliament?
I mean, look, these analysis we'll do on a very regular basis, because I don't, again, disagree with the fundamental premise of Paul O'Kane's question, which is if you pay people better, then you've got a better chance of both recruitment and retention. So we believe in that. What we can't do is, so notwithstanding that he and I completely agree in the premise of the question, excuse me, that he asks, what we can't do is take money out of the health service, because we still need to deal with the demand pressures that we have in the NHS. We can't just take £1 billion out and say, right, we're going to put £1 billion in here, and because we think that will, that's money better spent here. Now, we'll do that to an extent, because that's the entire point of budgeting. But I couldn't justify taking the cost of £15 an hour, even £12 an hour initially at the moment, away from the NHS and into social care. Now, I'm very keen to work with local authorities, very keen to do what we can to continue to increase pay where we can. But it's not just about pay. Pay, I accept, is fundamental. I think there's something around terms and conditions around the social care workforce, career progression around the social care workforce. So I think if there's more we can do in that space, I'm absolutely up for it. So yes, I mean, this is always part of the kind of calculations and analysis that we tend to do. But I don't think Paul O'Kane would suggest, maybe as I should put words in his mouth, but I don't think it would be a suggestion to take the cost of, what it would cost us for £12 an hour out of the NHS just now and put that into social care, because it would have a very significantly detrimental impact on the NHS at this stage.
Convener, I think given the acute situation we find ourselves in and the announcements that the Cabinet Secretary will make later this afternoon, I think that piece of analysis, to me, that very detailed piece of analysis on the benefit of increasing pay is something that should stand alone and be done by the government. I think also I'm keen to understand the Cabinet Secretary intends to make an announcement, I'm sure, about in further detail about the beds that he will purchase in care homes. That will require a staffing element. We know, again, about the staffing challenges. And I think not just that, because obviously there are care at home staffing issues, and I agree with him on terms and conditions. My sense from his previous answers are that, again, we're in the kind of 4 years down the line, a national care service will deliver all of this and we can move the dial. Does he not accept that we need to do more now and that we need to look at these issues right now instead of wishing them away, if you like, into the national care service?
So look, I certainly disagree with the characterisation of the question, because I've made it very abundantly clear that we don't intend to wait for the National Care Service to make improvement. And so for the time that I've been Health Secretary, we've announced 3 pay increases, £10.02, £10.15 and the next one to £10.90 in terms of 23-24. So we're not waiting for the National Care Service to come into place to continue to uplift wages where we can. So that's absolutely got to be a part of it. So I don't really have anything more to add that he and I haven't already rehearsed. But I think if people are going to call for a wage uplift, which they are perfectly entitled to do and with good reason, they've got to do that within the context of a fixed budget. So every single penny of the £19 billion in my budget has been allocated. If you think that there should be an uplift in 23-24 to £12 an hour, then you've got to be able to spell out where those hundreds of millions would come from within that fixed allocated budget, bearing in mind we've made really difficult tax decisions as well, which I stand by full square, I have to say, because I do think those who earn more should be paying more for strengthening our public services.